discuss about the analgesics and opioid analgesics. In that specifically we will discuss about morphine. Okay, so first of all we should know what is the analgesics, right? Analgesics are the type of drugs those are used in the relief from pain, right, without altering any kinds of consciousness of the patients or the individual. In case of the anesthesia, we are altering the consciousness of the patients at the specific region where we should introduce the anesthesia, right, anesthetic drug. So in case of the analgesics, we are not performing that kinds of incidents or any kinds of procedures, right? So we will move on to the opioid classifications. Okay, so opioid classifications, these are divided into three types, right? Opioid agonist antagonist, and opioid partial. Okay, under the opioid agonist there are three types classified drugs, right? First one is the natural, and the second one is the semi-synthetic, and the third one is the synthetic. And in the first natural opioid like morphine, codeine, noscapine, okay, and under the semi-synthetic classified opioid agonist, right, like holcodyne, heroin, hydroxymorphine, okay, and under the synthetic drug, like pethidine, fentanyl, and tramadol, different drugs. Okay, and next we will see what is the opioid agonist antagonist drugs like pentajocins. Okay, what is that? Pentajocins, progesine. And the next thing that is opioid partial analgesics. Okay, buprenorphine. What is that? Buprenorphine. That is the drug comes under the opioid partial analgesics. Okay, and next we will move on to the what is the pharmacological actions of the opioid. Specifically we will discuss about the morphine. So morphine is the natural opium alkaloid analgesics, right? So after the administrations of the morphine drug, what will be the pharmacological actions? Means what will be the affections on our central nervous systems, on our cardiovascular systems, on our gastrointestinal tract, on our urinary bladder, on our respirations? What will be affections? Okay, so let's move on to the pharmacological actions of the opioids, means the morphine. Okay, first of all we will say about the CNS. Okay, under the CNS we will see the two effects like depression effects and the stimulation effects. Okay, under the depression effects, the morphine, we are using different doses of the morphine, like moderate dose and high dose. In case of the dullness or the drowsiness, we have or continuous pain, we are performing the moderate doses of the morphine, the administrations of the morphine. But in case of the severe pain or traumatic pain, okay, visceral pain, so we are performing the higher dose of the administrations of the morphine. Okay, and the next thing, under the depression effect of the CNS, like respiratory depression will be affect. Okay, so respiratory depressions will be occur, means the persons will not be able to take breath clearly. So for that prevention, for the treating the respiratory depressions, we can perform the hyperventilations or provide them the ventilations for preventing the hyperventilations conditions or the respiratory depressions conditions. Okay, and also we can see the sedations, means the drowsiness, the persons will be drowsiness or dullness will become because of the administrations of the morphine. Okay, and the next thing, like stimulations, and one more thing, euphoria. Because of the administrations of the morphine, the persons will be feel that he is well, mean he is free from all kinds of pain. The feeling of the well-being, that is called, we are calling euphoria. What is that? Euphoria. So that is which all these effects comes under the depression effects of the CNS. And next we will see what is the stimulant effects. Okay, so under the stimulant effects we'll see the meiosis. What is the meiosis? The constrictions of the pupil in our eye. Mean, look at your eye, your own eye. Might be you have seen in our cornea one black pigmented pupil is there, right? So in case of the acute morphine poisoning, we can see that pupil is constricted, and along with that we can also see the pinpoint of the pupil is seen. Okay, so pinpoint of the pupil is seen, and also we can see the nausea, vomiting. Okay, nausea, vomiting, and it is also the responsible for the releasement of the histamine. Okay, so histamine is a receptor which is releasing from the mast cells. Okay, so from the mast cell histamine is releasing. So histamine is responsible for the itching and rashes in our skin. So because of the administrations of the morphine, we can see the itching on our skin and rashes also, right? And next we'll see, and also in our depression effects CNS, after administrations of the morphine, we can see it is directly suppressing the cough center in our medulla, which is present in our brain. Okay, so in depression effect also, morphine, after the administrations of the morphine, we can see the cough suppression is appear or rises. Okay, do you get me? Okay, so that is all about the CNS effect, and next we'll move on to the cardiovascular effect. Okay, what is the cardiovascular effect? Means after the administrations of the morphine, we can see the vasodilatations. Okay, see the normal vein and the dilated vein. Okay, so in case of the normal vein, there will be a chance of the increasement of the BP, but in case of the vasodilatations or the dilations, we can see the falling of the BP. What is the falling of the BP? Blood pressure should be falling down. Okay, and also we can see the transportations of the oxygens and nutrients and glucose will be more, and along with that the waste products also will be excreted more. Okay, so that is the CVS effect, is the cardiovascular system's effect. And that is the and next thing, the gastrointestinal tract, how it is acting in our gastrointestinal tract after administration of the morphine. So after administration of the morphine, we can see the constipations, the persons will suffer with the constipations. Means he will not able to defecate properly because of the administration of morphine. Okay, he will suffer from the constipations. And next we'll see the urinary bladder, how it is acting or how it is affect on our urinary bladder. So in the urinary bladder, see the normal urinary bladder, and in the case of the retention, urinary retentions of the urinary bladder. So in case of the normal urinary bladder, we can see the whenever the urinary bladder is fulfilled up to the 600 to 700 ml, the person will feel to void it. Means the person will feel to urinate it. Okay, but in case of the urinary retentions, due to the administrations of the morphine, the bladder will be retained with urine. Mean the urine start absorbing in our urinary bladder. Okay, so that is about the urinary bladder. And next thing, we can see the bronchospasm in our bronchi. Okay, because of the releasement of the histamine from the mast cells. Okay, so these histamines are responsible for the bronchospasm. Understand? So that is all about the cardiovascular system, central nervous systems, gastrointestinal tract, and urinary bladder and bronchi, all about the effects, how it is acting in the all those sites after the administration of the morphine. Okay, that is about the all pharmacological actions of the morphine. And next we'll see the roots of the morphine. So how it is administered into our body? How? So if we'll take or if we'll administer the drug of morphine through orally, we can see the bioavailability is not fulfilling up to the 100%. Means the first pass effect is present in case of the oral absorption, in case of the oral administrations of the morphine. But if we'll take the morphine drug through intramuscularly or IV or intravenously, subcutaneous route, or sometimes epidural route also, so there we can see the bioavailability is more and the absorption is more. Okay, so we can prefer the morphine administrations more than more than oral administrations, we are preferring the subcutaneous route or intramuscular, intravenous. Okay, so that is our the routes. And next we will see the adverse effects. Okay, what is the adverse effects? So I'll tell you very easily, you can remember very easily, it is very easy to remember. Okay, I will tell the order of the acronym order. Okay, so adverse effect of the morphine, morphine, right? So morphine. So M for meiosis. Okay, meiosis means the, as I taught, meiosis means the pinpoint of the pupil, right? So that is one of the adverse effect of the morphine administrations. M for meiosis. O for orthostatic hypotension. Okay, so the pressure will be falling down, so hypotension will be seen. Okay, MOR for respiratory depression. Okay, as I told in the CNS defect, depression defects, so respiratory depressions will be seen, right? And the next thing, the MORP, P for physical dependency, mean because of the prolonged uses of the morphine. Okay, so the persons will be habituated with the drug. Okay, person will be habituated with the drug. So because of the habituated, you can see the dependency up to the dependency towards the morphine drug. Okay, so MORP. H for histamine release, releasing of the histamine responsible for the bronchospasm, as well as the like itching, rashes, all those things are responsible for the histamine releasing. Okay, HMORPHI. I for increasement of the intracranial pressure, mean intracranial, intra mean within, cranial mean our brain. Okay, so the intracranial pressure will be increased. Okay, so MORPHIN. N for nausea. Nausea means the persons will start feeling to vomit. Okay, so because of the administration of the morphine, we can see the adverse effect of the like nausea. And E for euphoria, means the feeling of the well-being. So that is also one kind of adverse effect of the administration of the morphine. And along with that, we will see what is the physical dependency of the morphine. Means the persons, after the due to the prolonged uses of the or taking the morphine drug, the persons will habituated towards the morphine drug. So for that, leaving that habit from that person, we have to treat the physical dependency, right? So for that, we have to send the person or the individual to the hospital, right? Means the hospitalizations is very important, right? And also we have to treat like sudden withdrawing of the morphine drug. Okay, and substitutions of the methadone. Okay, so methadone is a synthetic opioid analgesic. Okay, so we can prefer for leaving the habit of the taking morphine drug, we can prefer the methadone. Okay, substitutions of the methadone we can prefer. And so that is and we can also send the persons to the rehabilitation center. And psychotherapy also is very preferable for the treatment of the physical dependence of the morphine. And next we'll see what is the acute poisoning of the morphine. Acute morphine poisoning mean if the persons will take more than 50 mg morphine, so he will prescribe as a acute poisoning of the morphine case. Okay, so for acute poisoning morphine, what will be the signs and symptoms? Like convulsions, meiosis means the constrictions of the pupil or the pinpoint pupil. Okay, and also we can see the falling of the BP. Okay, so these are also the signs and symptoms of the acute morphine poisoning. And also we can prefer and how to treat the acute morphine poisoning. How can we treat the acute morphine poisoning? So we have to do first, because of the poisoning case, right? So how to treat? We have to do gastric lavage procedures. We have to clean the stomach, right? So for that we are using here the potassium permanganate, okay, KMNO4. So we are using the gastric lavage procedure. For that we are using potassium permanganate, and also along with that we can also using the administrations of the IV fluid administration is very preferable or necessary in case of morphine acute poisoning. Acute morphine poisoning is very necessary, okay. And also we are using one drug like naloxone, okay. What is that? Naloxone. So that is the naloxone is the drug, one type of antagonist, specified antagonist drug, which is used to very useful for the treating of the acute morphine poisoning. Acute morphine poisoning, we are it is very useful. What is happening after the naloxone giving? So after the giving the naloxone, it is directly blocks the morphine receptor, okay. So the morphine receptors, those are present in our spine or supraspinous region, it is directly blocking them, okay. So thereby we cannot see the morphine poisoning. The persons will feel well, okay. So that is all about the topic. And also one thing like contraindications. What will be the contraindications for the morphine? We cannot prefer the morphine drug in which conditions? What are the conditions? So in case of the head injury, traumatic case, right? So if the person is having the head injury, we cannot prefer the administrations of the morphine drug, okay. And along also we can see the COPD, okay. COPD, chronic obstructive pulmonary disease, means the persons, if the person is having prolonged obstructive pulmonary disease, okay. So we cannot prefer this type of drug administrations. And also the patients, those are like pregnant and neonates, adults, okay. And so that is about the contraindications, okay. So that is all about the topic, okay. I think you all have understood the topic. If you having any kinds of doubt, you can ask me questions below to the comment box. And please subscribe the channel for getting more uploaded videos, and don't forget to press the notification bell icons. And you can also follow me into the Facebook page. That link is given below to the description box, okay. So up to that, stay safe, stay happy.